Respected fellow Foxians, welcome to 27th episode of unique podcast series Gyan Pravah, which is the brainchild of our dynamic, visionary, and loving president, Dr. Sunita Tandulwadkar Madam. I, Dr. Kavita Bandwa, Chairperson Eurogana Committee, will be your host on 24th of every month and present before you various legendary personalities who will share their thoughts on various issues including urogynecological problems. Today, we have two giant legends, most vibrant President of Fogsi, Dr. Sunita Tandulwadkar Madam, and Padma Shri Awardee, Professor Dr. Shanti Raman. Before starting podcast, I am here humble and honored to introduce Dr. Sunita Madam, who is HOD of IVF and Endoscopy Center, Ruby Hall Clinic, Pune. She is founder and medical director of Solo Clinic IVF, where she deals her infertility patients sympathetically and personally. Dr. Tandulwadkar Madam is co-founder and medical director of ELI Stem Cell Research and Application Center, Pune. She is world-renowned IVF specialist and has credit of world's first stem cell baby, which proved a milestone in IVF services. She is president of Fogsi, a group of 46,000 gynecologists, and joined just 35 days ago and serving the society in all her capacities. I think Tandulwadkar Madam has some divine power. With the blessings of her Guru Gyan Maharaj, she achieves what she desires. She is President-elect Ishar of 2526 and author of various books and publications. She has been invited as a faculty in more than 400 plus national and international conferences, and to her credit, many laurels and awards have been named like IVF Icon of the Year, Bharat Gaurav Puraskar, Rashtriya Gaurav Award, and many more. She has also received a prestigious award by President of India. So I request her to say a few words and bless us.
Thank you, Kavitaji. Thank you for your kind words. And Shanti Madam, pranam, pranam, pranam.
It is lots of blessings. Lots of blessings.
It is such an honor to have you on the Fogsi platform. And I need to thank Kavita for that. She chose her first podcast, The Faculty Larger Than Life. I still remember during my IAG presidency, we gave you Lifetime Achievement Award when we came to Patna for our state conference. Friends, this Gyan Pravah, knowledge which keep on flowing every day at 8 p.m. with my 30 committee chairperson is the most important academic project of my year. The conferences, the CMEs, the UA Foxes, they will keep on happening. But this podcast is one where 45 minutes, my single committee chairperson takes a beautiful dialogue with academic or non-academic personalities, may it be politician, philosopher, social worker, or so on. And they try to give very educative and informative podcast. For this, they work very hard for an entire month. So if on 15th, for example, you are going to have Kavita, every month on 15th, you will have Dr. Kavita. So the 30 days, 30 committee chairperson doing amazing work every day, one person in action, apart from so many other activities in the academic and social project they do. Committee chairpersons form the very basic core of our organization. They work for 3 years, so with 3 Foxy presidents. And I think they are the leaders of our Foxy for future. So they imbibe what is best from each and every president. They start thinking themselves, they become creative, and I'm sure when they will become a vice president and president one day, they will be one of the best in our country. Today, Kavita has involved Dr. Shanti Rai. I should say Padma Shri Shanti Rai, Madam. It's an honor to be in a frame with you, ma'am, always. I know how much you have worked, not only in Bihar, but your passion, your teaching has gone beyond the territory of Bihar. And I'm sure today's podcast will explore more about Padma Shri Shanti Roy to the world. Thank you so much.
Thank you so much, madam, for your kind words and blessings. So just wait, I will introduce another legend, Dr. Shantira, madam. She is mother of Dr. Himanshu, and Dr. Himanshu is my batchmate. So we call her Ma. So madam is not only our teacher, guru, but she is also our Ma. So Pranam and Charan first, madam. So madam needs no introduction, but just I am introducing her in a few lines. She is center head of ICOG Training Reproductive Medicine, Shivam Hospital. She was chairperson of Ishar Patna, fellow guide of Narchi, ex-president of Bihar of OBG Society, ex-member of ICOG Governing Council and organizing chairperson AICOG 2014. Madam has written and edited many books for consultants like Practical Guide for Obstetricians, Practical Guide for Gynecologists, and she has also written books in Hindi for common people and paramedics like Stri Rog Gyan and Garv among Prasav Gyan. Madam has served the rural society in so many ways, and she is really honored by President of India with the Padma Shri in 2020 for what she deserves. She has also received other awards like Lifetime Achievement Award by IMA, Fogsi, OGSS TAIOG, Box, Icon of Bihar Award, Icon of Health Award by Times Group, Doctor's Pride Award, and many other groups. Like Sunita Madam explains, Madam has received award by Madam also, Sunita Madam. So really, I feel honored to be her student in undergraduate as well as postgraduate days. So with these words, I request Madam that I will ask a few questions, request her, and she will answer briefly. So thank you, Madam. Thank you, Sunita Madam, and thank you, Santira.
Thank you, Shanti Madam.
Thank you so much, Sunita. It is really, I feel proud of you. You are so beautiful. You have managed everything and doing so well. I really do expect many, many things from you. I wish you a very, very, very good future. And I am sure that Foxy will reach high, it will be much higher achievements will be there by your control and your attempts.
Thank you. Thank you, Madam. Thank you, and wish you all the best, Kavita.
Thank you, Madam. Thank you so much.
Thank you, Kavita, for introducing
Madam,
me and giving me such a good introduction.
Yes,
Thank
Madam.
you so much.
Yeah. Thank you, Madam. So now our podcast will start. So what should I ask from Madam, who has been HOD in my undergraduate and postgraduate days? Though today we have requested her to be a guest, so she will answer my questions. So, Madam, I am requesting you. You have been an inspiration to many of us, and we were honored and with reward Padma Shri Award by Government India, and you have served not only HOD PMCH Patna, which is a premier institute of our country, but in all rural areas also. So, if you permit, I would like to ask a few questions related to your life and experiences. You have worked with many illustrious gynecologists of Bihar, like Dr. Kamla Achari, Dr. Anmola Sinha, Dr. Jagdishri Mishra, Dr. Raj Norane, and Dr. Malti Rohtagi. So, Madam, how you feel? So, first question, how you balance your personal as well as your career? So, you have achieved everything. So, Madam, how you have achieved?
Kavita, actually, it is really difficult to have a balance between family life and professional life. If you want to be sincere to both of them, it does tax you too much. But I was lucky enough that my husband was very supportive. He was head of the department in ancient Indian history, and he mostly used to look after children. He gave them education. He tried everything to make them good human beings. And I am really grateful, thankful to God for giving me such a nice partner.
Yeah. Madam, actually, this was my another question. Madam, how you manage, and it was extremely difficult to enter the medical field back then. So who inspired, helped, and guided you to be a doctor and to serve the society like this?
You are very right. It was really difficult because at that time I entered medical college in 1957 and I was in a village. I come from a village where there was no facility of any media. No paper came, there was no TV at that time. We had no information of the outside world except of that village only. And therefore, I couldn't know what are the various avenues where a girl can go or can do anything. It was my grandfather who was born in the year 1880, I think. I was born in 1940. He was born in 1880 or near that. He took care of my education, and he at that time also he was so much जागरूक कहेंगे उसको, was very much aware that girls should study, they should go in schools, colleges, and they should do something. So it was my grandfather mainly, and my mother too. She was very young when I was born, but she was very much interested in education. She was a school teacher, and she took care of mine. So these two people were mainly responsible for making me a doctor.
थैंक यू सो मच। तो मैडम, आपके ग्रैंडफादर मतलब उस समय उनकी सोच इतनी अच्छी थी कि मेरी पोती अगर पढ़ना चाह रही है तो मैं उसे आगे बढ़ाऊं, उसे पढ़ाऊं और डॉक्टर बनाऊं। सो रियली, सो सैल्यूट टू हिम एंड सैल्यूट टू योर मदर आल्सो। सो मैडम, यू हैव बीन ऑनर्ड विद द रिवर्ड पद्मश्री अवार्ड by government India. So how you think this award? So
it's a great thing, no doubt. I am very much thankful to the people of Bihar and our Prime Minister, our government of India, that they chose me to give this award. This is a very prestigious award, and I feel that by honored with this award, I have become more responsible towards my duties to the public, to the state, and to the country. And this, I don't think at all of myself. I always think of people around me. I always think of patients. I always think of rural areas. I think of my state. How can we improve it? And I am really thankful to the government of India and the president who gave me this award.
Madam, that I have seen. I have passed from Patna Medical College. We were HOD at that time, so we have learned everything from you. And I know you serve the society, especially rural and backward people. So really, we all are very honored and humble that you have received Padma Shri Award. So really thankful to Government India that our teacher, our mother, have received this important award. So, madam, the Prince of Wales College, that is PMCH, was one of the best medical colleges. Its rank was 6th. And stood a proud rank of being 6th among all medical schools in India. However, even after passing from such a prestigious institute, we have been devoid of training in many newer aspects. So what is your opinion on this? Why we gynecologists of Bihar are lagging behind in the field of endoscopy, urogynecology, and infertility practices? Though I am chairperson of urogynecology, I have been elected, but I think these fields we are very behind as compared to other states of the country. So what is the difference and why we are lagging behind? What do you think about it?
First, I must let you know that all my students, like you, Dr. Kavita Barnwal, and many more, many more, they are very good doctors, and wherever they are making a name of them. And people of their locality, they always take your name and my students' name. And I'm feeling very honored. I always feel honored that my students are doing so well. So thank you for being so sincere, so dedicated to your profession. You are really, it is right that we could do much more than what we are doing. And I think you also must be thinking like that there was a period between a period of, I think, 15 years, or 20 years, when the medical college was deprived of everything. You must be remembering the days when people had to bring water also for washing before operation. There was no help from the government side. It was very difficult. And in those days, things got deteriorated and deteriorated. And students, then they could not learn anything which was advanced or anything about advanced technology. It became very difficult because we were put in that situation.
Yes, madam. So whenever we organize any camp, like recently you have witnessed, you were chief guest at Rajgir. This was IG
Yeah.
program, and many laparoscopic surgeons who were operating were from other states. So why we lack, and could there not be an influx of doctors from our own fraternity of the state? Why we are so lagging behind? Because it may be because our colleges had no such facilities and we got deprived in spite of being so hardworking, dedicated, and talented. Bihari people are very talented, very hardworking. Still, there is some lag behind. So, yeah.
Actually, at individual level, every doctor is very, very good. He's very dedicated and doing the best of what she can do. But probably we lack in teamwork. And due to the lack of teamwork, every person has his or her own clinic. He is trying his best in his or her own clinic. But if we get combined, a few of talented people like you get united, set up, and then think of it, there is some mindset also. We are not thinking of going so far, and maybe that is the reason. So have a mindset that we can do anything, have a teamwork, combine a few people, and then try to do. We will be successful, no doubt, but we will have to change our mindset.
Yes, yes, madam.
Everybody should try to be helpful to others, and a
Yes.
few people combined can make it successful.
Yeah, so you're right that teamwork, and I think sharing the knowledge and sharing these practices can help us to achieve the national levels. I think so. Still, we are lagging behind. So, what we should do, that you have well explained, that teamwork along with the sharing. So, this is very important, and then only we can go higher and we can share to the national level.
Because the modern technology requires many costly instruments, and these
Yeah.
instruments may not be possible to buy for everyone. But if 4 or 5 people combine and they buy it, they work for it, then it will get easier.
Yes, madam.
So we should.
Yeah, so we are good in obstetrics because it doesn't require many important heavy instruments. Yeah, so but in other endoscopy, infertility services, I think Himanshu is lucky enough that he got support from you and all other people that he could start infertility practices earlier. But most of the people are lagging behind. So I think this is very important, that infrastructure and the cost of the instruments, also the training, because we had no facility in our colleges, so we couldn't get trained in these things, and we are lagging behind. So madam, there was a time when Bihar was viewed and revered as the land of knowledge, like the birthplace of Dr. Rajendra Prasad. Bihar is the birthplace of King Chandragupta Maurya, great Chanakya, Ashoka, and all these. So how can we bring back the glory of Bihar? So what do you think? That medical practices also, we should bring glory to Bihar. So this actually the topic I choose, that gynecologic practices in Bihar, yesterday and present, because we all were very, I think, brilliant, and you did the best. But nowadays, when we compare from your time, we are very far behind. So how can we bring back glory of our Bihar? So what are your suggestions?
Kavita, one thing that is very important is to be honest. Honest to ourselves as well as to others. If you, any duty, whatever you are doing, if you do it honestly, with full dedication, then I think you will definitely be successful and rise above others. So honesty, dedication is very important. You must be truthful. And one thing I think which is due to which we are lagging behind is that we are too busy. Every doctor who is a good practitioner, who works hard and who works with dedication, he gets very busy because people do recognize that this doctor is very good. He examines very nicely. Her advice or his advice is always good. Then she gets a lot of patients. She becomes too busy. She gets less of time to write anything. She has got much experience, but she has no time to put it down to the pen and paper, and therefore we lack in publications. The lack of publications is only due to the lack of time. So we will have to think about us in a greater way, and we should have a clerk, a
Computer operator like
computer person who does all the work. We should get better people, infrastructure to have everything recorded and to come to the light.
Yeah, actually, I think we all have enough number of cases, and also we have knowledge. So we should go for publications also, not only for just examining the patient, earning. So
Because you don't have time. That's why you
yeah,
don't go for publication. So
yeah,
we must get some time for publication. Then
yeah.
only it can be possible.
Yes, yes, madam. So I think this is very important that we should have work balance. So not only just examining the patient, but we should also report and we should go for research also. That only we can go for other like publications or in any journals, we can go for writing or editing the things. So this is very important for all of us. Madam, I would like to help us with suggestion that we can extend to the government and the doctors of the state. We should uplift the standards of medical practices in our area. Though we all are working, we all are serving the society, but still maternal mortality is higher as compared to other states like Maharashtra, Kerala, Gujarat. So, what suggestions you would like to give to the government as well as to us, to doctors of the state?
Actually, maternal mortality as well as other figures are coming down with the help of the government. Government is doing a lot of work to bring maternal mortality, infant mortality, pediatric deaths. Everything is getting down, and we are at the health level. We are at a better place than before. But still, we need to be much higher, and for that, it is my thinking that the government is doing a lot. It is improving the PHCs, it is improving the subdivisional hospitals, reference hospitals, many hospitals where cancer can be treated. Everything it is being done. But the infrastructure is not that good. And also, if the people are not well trained before they are appointed, then it doesn't become successful. So the training, the dedication and honesty is very important at every level. Before appointing, the person should be well qualified for that position or that post, and then only she should be appointed. By opening so many medical colleges will not help if the studies or there is not being done properly. The teachers are not good. The faculty is not coming in time. They are not teaching discipline to the students. Students are not attending the classes. Then only opening the medical colleges will not be helpful. Government should be strict at certain levels, and that will probably be better.
Madam, you are a great Shiva devotee. I have seen you. You have also named the hospital Shivam Hospital. So, madam, how you relate worship with the medical services to the patients? What we give to services, that it help worship to God like Shiva, and what we practice to the women to the for medical services. So, what do you think? Is there any relation? Because nowadays I think most of are being scientific. They don't believe in religion. They are being atheist. So how you think? I know you are a great Shiva devotee, and we also are devotee. So I just want to know, madam, do you find any relation between worship and your medical practices?
I don't know whether there is any relation or not, but before coming to the consultation room, I do worship God, mainly Bhagwan Vishnu, and I do ask him only one thing, that patients who come to me, they get well, they recover from their problems, and that's all. I
Madam,
do believe in God.
yeah. So I think most of us should believe and should worship because God is there who can help us in every place, even in OT and emergencies. So I have seen you worship, and that I thought to us. So, madam, thank you so much. If you like to give any more suggestions, we are happy to hear you. So just give a few suggestions, and thank you so much for joining this podcast. If you want to say any suggestions, any blessings to us for the
I,
upcoming doctors.
I shall like to give the suggestion to government that instead of opening many colleges, because government thinks that by producing many doctors, it will be a better healthcare. Definitely, the number of doctors related to the number of patients will be good. But only producing doctors by name will not be enough. The doctors must be qualified doctors. They must come to the colleges. They are not coming to the colleges. In most of the colleges, hardly students come to attend the classes. So how can they be a good doctor? They don't attend clinics. They don't attend patients. They don't do ward duties. They don't do tutorials. Then only by opening the colleges, getting them admitted and getting them passed will not serve the society or our public. So the government should be careful about that, and they should be quite strict that students must be regular, the teachers must be regular, and then the teachers can do private practice. After doing their proper hospital duty, they can engage in private practice. To the patients, I will say that believe in your doctor, whomever you consult, believe in him or her, and whatever she says, do it. Then only you can get cured. And believe in yourself that you will get cured.
Yeah.
So thank you very much, Kavita.
Thank you so
Thank you
much,
so
madam.
much.
Thank you, and
It
once
was a
more.
pleasure to see you, to
Yeah.
talk to you.
Yeah.
Very nice.
Thank you so much,
Thank
madam.
you.
Thank you,
And lots
madam.
of
Thank
blessings.
you. Yeah. Thank you, madam. And Charan Spurs. Thank you, Sunita, madam, for joining and giving us opportunity to talk. So thank you so much, madam. So I think your suggestions will be a milestone for all of us. Thank you so much, madam. Okay.